It's been close to 4 weeks since Rwanda went into a total lockdown, one of the toughest measures adopted by several countries across the world to contain the spread of the deadly coronavirus. The decision to a lockdown was initially declared on March 21st for 2 weeks and later extended for additional 15 days by the extraordinary cabinet meeting and announced by Prime Minister Edouard Ngirente. Shops and markets were closed, save for those dealing in essential commodities like food and pharmacies. Unnecessary movements outside homes not permitted. Electronic and online transactions encouraged. Non-essential service providers both in public and private sectors asked to work from home. All bars and pubs closed, while restaurants were only allowed to provide takeaway services. Citizens were and still are required to practice social distancing as the world continues to grapple with this invisible enemy. Experts in epidemic and disease control told us that Rwanda's stringent measures towards controlling the spread of coronavirus have paid off. We spoke to Dr. Karemera Marie-Claire, a seasoned epidemiologist and researcher with 23 years experience, and Dr. Uwera Jacqueline, who is currently working with the National Task Force fighting coronavirus in Gasabo district. This period of lockdown has helped us a lot because it significantly reduced the rate of infection and made contact tracing much easier. Early lockdown and confinement helped us a lot as physicians who are fighting this pandemic. In some countries, lockdown was announced late after multiple infections, which made it difficult for them to control the disease. This lockdown helped us in contact tracing and isolating infected people. The spokesperson of Rwanda's civil society platform, Dr. Joseph Nkurunziza, calls on authorities to introduce mass testing for coronavirus, saying that it will shorten the time of lockdown. This, Nkurunziza says, will also lessen the damage of lockdown on people's lives and the economy in general.
The lockdown was one way of trying to minimize or to contain the pandemic. But one way of that would be which can contribute towards knowing how far the people have been infected by the virus is to try and have some massive testing. But that is costly. That would require lots of resources, and also that will require other stakeholders to come in so that testing can be done, so that that would also facilitate the decision makers to know how and when to reduce on the lockdown, but also trying to make sure that they've reached all the contacts that came across the cases that were infected. So that requires some extra efforts and some extra resources. So the lockdown would depend on how the health sector has been able to control the epidemic.
The Minister of Health, Dr. Ngamije Daniel, urges the general public to follow government guidelines until coronavirus curve has flattened. People should not panic because of unsettled number of infections. That's how it happens with an outbreak. Until we have 0 new cases of infections, everyone should keep abiding by the set guidelines. The decision for the lockdown was adopted by the government, and the general public should wait for the next decision, which will be informed by the situation on the ground. The World Health Organization urges all countries to continue lockdown measures until new infections have reduced. Primarily, World Health Organization says countries with reduced infections should lift lockdown partially and gradually until there is no infection at all. Reporting for RwandaTV News, Ethan Tashobia.